and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hi, Minister.
Good morning.
Good morning. So this morning, I would like to start with our vaccination program and update on it. What is the current population that is vaccinated?
Well, as of yesterday, we have 198,956 persons who have received their first dose. This would be about 40.9% of our adult population, and hopefully we'll pass the 2,000 mark today. So we continue to work on that. And for second dose, we have been able to vaccinate 68,333 persons. This would be approximately 14% of our adult population.
Okay. So I know on Saturday there was another vaccination drive in Region 2. Can you say what the response was like?
I think for Region 2 it was fairly good. They were able to do around 250 vaccines in that drive-through. And then yesterday they did another exercise that yielded about 253 or so.
That was in the same area as well?
In Anna Regina. So I think for those two exercises, you had a little bit more than 500 doses being administered.
Okay. Now, Minister, I want to speak a little bit on the COVID-19 deaths and recoveries. I know a lot of people are seeing the high number. Well, it's about 300 and something right now, persons that have died from COVID-19. But do you think that Guyana has done well in clinically managing COVID-19 patients compared to other countries?
We continue to manage the patients as best as we can. As you know, 80% of the persons who are infected with COVID would not be hospitalized. And so for those persons who come to the hospital, we normally would evaluate them. Those who need ventilatory support or other forms of respiratory support, we are able to give that to them. And of course, there are medications that you can use. So we have been working very hard to make sure that we have more persons recovering from hospitalization. As it is for today, when we look at how many cases we've had, total amount of cases, we've had 16,952 cases. And of those, 14,522 have recovered. We currently have 2,041 active cases. And of those, we have 104 right now in hospital, with 23 in the ICU. And of those in the ICU, I think we have 4 patients on ventilators. So it is a challenging task to manage those persons that we have in hospital. And I think the medical staff at the hospital, because they're not just at Ocean View, but they're also at various regional hospitals. The medical staff, they've been working very hard to make sure that to assist people to survive this disease.
Okay, Minister, thank you for that. Now, I know last week you would have mentioned that we are expecting the delayed shipment of Sputnik V sometime this week. Do we have any update on the expected date it's supposed to arrive and what quantity is coming?
We're working on the logistics and the quantity, so we don't have final numbers as yet, but as soon as we have that, we'll be able to release it.
Okay, and over the weekend, persons did express worry and fear that the ministry may be running out of the second dose of AstraZeneca. Can you give some words of reassurance that this is not happening?
Well, again, I don't know how much we can reassure, but as I've said in the past, and I continue to say, AstraZeneca, the vaccine, what you get for first dose is the same vaccine you will get as your second dose. And because we know that, when we receive AstraZeneca vaccines, what we did was to keep half of it as the second dose. So every person who would have received AstraZeneca vaccine, we have your equivalent second dose in storage. And so once you're due, we're asking people to come forward and get their vaccines. Now, earlier we had said, and this is based on the science, that we want people to wait between first dose and second dose for 12 weeks. Because when you wait for that longer period, the efficacy of the vaccine goes up. But there have been a lot of people who are calling, I guess because they're afraid that vaccines are going to run short, that they want to come early and get their vaccines. Just for people's peace of mind, if they want to come a bit earlier, they can come. So anyone between 4 weeks to 12 weeks can come to any one of the vaccination sites and get their vaccine. We have enough AstraZeneca available, so please, if you want to come and get your second dose and you fall within this 4 to 12 weeks period, please come and you can get it at any one of our sites. We also have, as you know, we initially had about 20,000 doses of Sinopharm, and the Sinopharm vaccines are similar. What you get for your first dose is the same vaccine you will get on your second dose. Now, we have given out most of the Sinopharm first dose, and what we want now is for people to come back and get their second dose. The vaccine, the interval between first and second dose, it's 4 weeks, and we know that there are quite a number of persons who received the first dose and now due for second dose, but they're not showing up. So I want to make a special appeal to those persons who have received their Sinopharm vaccines. Please come and get your second dose, because we want to make sure that you get your second dose so that the efficacy can go up. Now, with all the persons who have received first dose vaccines, we are really happy that people came forward in getting their first dose vaccines. As I said before, we have approximately 198,956 persons who received their first dose. However, as you know, when you get your first dose, the story is not over, because we still see a few people can get infected after the first dose. We want people to come back and get their second dose, because we have seen that everyone who have gotten their second dose, they're not getting the infection. We haven't had any case of anybody getting the infection. We haven't had any case of persons who are fully vaccinated coming into the hospital. We have had no case of someone who's been fully vaccinated getting into the ICU, nor have we had any case of someone who's been fully vaccinated dying from COVID. So if you got your first dose, we are really pleading with people, come and get your second dose. Now for the Sputnik, those persons who had first dose Sputnik, we are going to get your second dose. And as you know, we have extended the time for any time between 4 weeks to 12 weeks. So any time between then. And as soon as we get the second dose this week, we'll announce it. So those persons who are due can come and get their second doses.
Okay, Minister. Now, before we move on from vaccines, I know you would have announced this morning on the radio that we have procured some 15,000 doses of the Johnson & Johnson vaccine. Can you tell us a little bit about that?
Well, as you know, the government's policy is that we are looking at multiple sources to acquire vaccines. And so while we continue to work to get Sputnik V, we've also been working to get other types of vaccines. One such partnership, which I had spoken about earlier, is a partnership between CARICOM and the African Union. And through that partnership, the African Union is making 1.5 million doses of vaccines to the Caribbean. And of that set, Guyana is going to get approximately 150,000 doses. And last week, we made a down payment on those doses. So we are hopeful that during June that we'll be able to get those vaccines. What we were told is that the vaccines would be the J&J vaccine, which is the one-dose vaccine. And I think once we are able to get that, it would be very appropriate for us to use that, especially in the interior areas, because some of those areas are very difficult to reach. And if you give the one shot, then that would be very helpful for the staff out there. So we are very happy to be able to source the J&J vaccines, and as soon as we get them, we'll start distributing them and rolling them out into those communities. We have also been working with COVAX, and we are due to get another set of vaccines from COVAX. Hopefully by the mid of June, we'll be getting those vaccines as well. And we continue to work on other sources to make sure that we have enough for everyone in the country.
Okay, thank you for that, Minister. Now, today, Guyana joins with the rest of the world to observe World Non-Tobacco Day to raise some awareness on the dangers of smoking. Can you tell us, is it dangerous to smoke during the COVID-19 pandemic?
Well, it's dangerous to smoke, period, because, smoking, every year, about 8 million people would lose their life to smoking. So smoking is quite a dangerous activity, and it's not just for the smoker, but for persons who might be standing or sitting nearby. Secondhand smoke is as dangerous as the person who is smoking. And a lot of people might, be affected by that. In Guyana, we have been able to pass legislation to deal with smoking. What we have to do is to make sure that the things that are in the legislation are enforced, so as to reduce the consumption of tobacco products. So it's something that is ongoing. We also have been working very closely with the Tobacco Convention. We are a member of that body. And we have been running a number of training programs within the ministry. Within the Department of Chronic Disease in the ministry, this is one of the areas that we have been looking at, because smoking, as we all know, it's a risk factor to so many things, including cardiovascular diseases and other diseases. We know there's a direct linkage between smoking and lung cancer and other forms of cancer, like cancers in the throat and so forth. And therefore, we really want to encourage people to quit smoking. And the way that we have been going about that is to use the WHO method, which is called EMPOWER. M meaning that you have to monitor the use of tobacco products and to look at prevention strategies to prevent the use of tobacco products. P means to protect people from the use of tobacco products. O means to offer help to those who want to quit, because there are a lot of people who want to quit smoking, but because the nicotine in the cigarettes are very addictive, it is a challenge for people who want to quit, and therefore we want to offer them different solutions on how to go about quitting. W is to warn people about the dangers of tobacco smoking, and you would notice that on tobacco being sold in Guyana, that we have a picture on the package. Some of it is very horrifying, and that is to let people understand the consequences of smoking and what are the long-term effects of smoking. E is to enforce ban on tobacco ads, because again, at one period in time, there was a lot of ads on television popularizing the use of tobacco products and that it's cool to use tobacco products. So this is something that we want to get rid of, no advertisements, and these things are all in the law. And of course, the R in Empower is to look at raising taxes so that these products are not readily available and they're like a luxury item. So We continue to work on this methodology because we think the Empower represents all the key elements of a comprehensive tobacco strategy, and that's what we have been working on to implement here in Guyana.
Okay, Minister, I mean, I know we're in pandemic, but can COVID-19 be spread through smoking?
So again, if someone is smoking and they're positive for coronavirus disease, we know that when you open your mouth, that droplets, if you sneeze or cough, droplets can travel at least 6 feet away from the person, and that's why we have come up with this distance of 6 feet. But in what comes out of your mouth, there are also what is called aerosols, and those can travel even farther distances beyond 6 feet. And so it can put people, at risk. So if you have someone who is a smoker smoking a cigarette and they're positive, they can also, when they cough or sneeze, transmit that viral infection, and that can spread to persons who are around. So it is one possibility that with smokers, if you're around them and they're positive, that you can easily get transmission.
Okay, and do smokers get more severe forms of COVID-19?
Well, we know that the more popular way of the virus entering someone's body is through the upper respiratory tract, meaning the nose and the mouth, and then it goes down into the lung. Smokers generally, because of their condition, if they've been smoking for a long time, they would have some amount of damage in their lung tissue. And so COVID-19, it just complicates this whole process in the lung, because when the virus gets into your lung, it attaches on the ACE2 receptors in the lung. And with smokers, we can anticipate that you'll have more challenges. The first form of this disease, you normally see what is called a pulmonary form or the lung form of the disease. And when you see that, it means that the lung itself is infected, and therefore we need to pay attention to that. I think smokers would have a more difficult time because of the condition of the lung itself.
Okay, thank you very much for that, Minister, and thank you for your time today. This has been DPI's COVID-19 update. For more information, visit our website, dpi.gov.gy, or our social media platforms.